Please have your mic unmuted if you have a question. You're a member of the media and you want to ask a question. We will unmute you once we call upon you via the webinar. So with that, I'll introduce Dr. Rebecca Sonnenschein. Well, let's say a few words.
Good afternoon. So I want to tell everyone that we are still seeing record numbers of new COVID-19 cases. We're now averaging over 1,800 cases per day, and that we've seen about 36% of all of our cases just in the last week. Previously, we were averaging about 200 a day, so you can see that this is very much a dramatic increase that has sustained itself. And there's a few things that are really different about the cases that we're seeing now compared with the cases that we saw during the shutdown and before the shutdown. First of all, over half of the cases that we're seeing are in the age group of 20 to 44 years old. Previously, that age group made up about 1/3 of cases. This explains why the proportion of cases who are getting hospitalized is about 1 in 5 now, compared to about 1 in 3 previously. But even though these proportions of cases who are being hospitalized are lower, the total number of hospital and ICU beds that are occupied by COVID-19 positive patients has steadily climbed and is the highest that it's ever been. And that's due to the total numbers of cases that we're seeing. So we're going to continue to monitor that very closely. The good news is that about 10 to 12% of cases are in individuals who are 65 and older. And that, of course, is our highest risk group. And what this means is that people who are in our highest risk group seem to be taking precautions to protect themselves and prevent from getting exposed to COVID-19. Unfortunately, the increase in cases of those younger age groups likely reflects people in that age group going to work and to school or out in public. And I can't stress enough how important it is for people to wear a cloth face mask when they are going outside their home in public and when you're around other people and can't maintain that 6 feet of distance. What's happening in Maricopa County is happening across the country. I want everyone in Maricopa County to understand that every adult has an equal chance of getting infected from COVID-19 when they're exposed. We can all spread it to other people who are at higher risk of severe illness and send them to the hospital even if we just have mild illness ourselves. We know now that about 40% of people who are infected don't have any symptoms at all and probably don't know that they're infected and still can spread the disease. So even if you feel fine and you're completely healthy, it's still possible that you're exposing someone else. That's why it's so important to wear a mask when you're not at home, because this protects both you and the other people around you. And I know there are a lot of questions about the effectiveness of masks and why we didn't push harder for masks earlier in the pandemic. So in the beginning of the pandemic, we didn't have evidence that showed that cloth face masks were effective in preventing the spread of COVID-19. We did have scientific evidence that medical or surgical masks were effective, but there just weren't enough of those to go around for both healthcare workers and the public. We also knew that social distancing is much more effective, so we went with the science. We only recommend things that are supported directly by science. And it may seem obvious to you, but different diseases do spread very differently, and we didn't know for COVID-19 in particular, specifically whether cloth face masks would be effective. Later, CDC put in a recommendation and asked the public to consider wearing a cloth face mask based on some evidence that masks keep germs very much inside the mask and keep germs from going outward to another person when someone's infected and doesn't have any symptoms. Maricopa County Public Health followed suit and made the same recommendation right after CDC did, and that was to consider wearing a face mask in public. As soon as the evidence became available in early June that cloth face masks can effectively prevent the spread of COVID-19, both for the wearer and the people who are around the person wearing the mask, and with more information about how many people are infected without symptoms and without knowing it, we made the recommendation to require a cloth face mask in public. A requirement is a really big step. We value people's rights to make decisions about what they do or do not want to do. And that's why we needed enough good scientific evidence before we supported making mask wearing a requirement. Now we have the evidence to support the effectiveness of wearing cloth face masks to prevent COVID spread in Maricopa County, and that's why we support a requirement. It's more important now than ever with cases increasing so rapidly. I also want you to know that this is not forever. It is until we have the spread of COVID-19 in Maricopa County under control, and then we can reconsider all of our recommendations. And I want to genuinely thank everyone for your support in keeping our community healthy and helping to prevent this spread. Now I'd like to turn it over to our Executive Director, Marcy Flanagan, who's going to talk about how public health is responding to these rising numbers.
Good afternoon. Back in May, when we had around 200 new cases a day on average, we set a goal of our investigations and contact tracing operations to address 400 to 500 new cases a day by July 1st. The good news is that we hit that staffing early, and our goal was exceeded by June the 10th, when we were able to address over 500 cases a day. Our goal initially was to bring on 60 new public health employees. As cases have increased, we decided to bring on just over 100 public health professionals. As of today, we have hired 83 of those positions. We have also partnered with ASU, U of A, AmeriCorps Vista Volunteers, Crisis Response Network, and Banner Poison and Drug Information Center, all of which add people to help us reach out all of our COVID positive cases and their contacts. We've heard over and over again how much contact tracing is valuable in outbreaks. In public health, we use contact tracing early for a large number of infectious diseases. For certain diseases, it can be one of the most effective tools in our toolbox. For example, think of a person with a sexually transmitted infection. It is much easier for someone to recall their sexual partners so that we can reach out and do contact tracing with them, compared to a disease like COVID-19, which is spread when someone coughs, sneezes, or talks. Remembering everyone you've done these things with over a 2-week period can be difficult to recall, and you often don't even know them. In addition, we know that around 40% of individuals who are infected with COVID-19 are asymptomatic, so they may be spreading the disease without realizing it because they don't even feel sick. We are also hearing reports that with so many people getting tested, labs are taking longer to track and report all of the results back to public health. Public health can't reach out to people until we know that they are positive from the lab results, which makes our contact tracing efforts even harder. We are relying on people to get tested to stay home and away from others until they find out their test results and they no longer have symptoms for 3 days. With so many people in our community infected with COVID-19, and many of them not experiencing symptoms or not knowing they have COVID, it is important that we all assume that we could be infected and exposed when we are out in public. We still believe that contact tracing is one of the tools that we can use to help slow the spread of COVID in our community. It's important that people know they are positive, what to do when they know they are positive to prevent spreading the disease to others, and that people who are close contacts know how to watch for symptoms. That's why at Public Health, we are still doing our part. We are reaching out to every single positive case that we have contact information for within 12 to 24 hours of us receiving that test result. People who get tested and have a positive test get a text message from Public Health notifying them of their results and asking them to provide some information to Public Health. We are also working on adding an automated phone call to this process to help individuals who only have a landline. The additional information cases provide will help us to determine if they are high risk, like someone who works in a healthcare or child or school setting. This process allows us to prioritize cases who are at higher risk or come into contact with those who are at higher risk. As great as our process is, contact tracing is not a perfect solution. Unfortunately, around 15% of the cases we get come without any contact information. And only 5 to 7%, we never get their contact information, meaning that even after multiple attempts, we are never able to reach those individuals to give them their test results or find out who their contacts were. The best thing we can do now for our community is try to reduce exposures and slow the increase of new cases. Our commitment to you, the residents of Maricopa County, is to give you the facts about what is happening and what you can do. Everything we tell you is based on research and science. And here's what the science is telling us can help Maricopa County residents slow the rapid growth of COVID-19 cases in our community. First, practice social distancing as much as possible. Second, wear a mask when you cannot keep at least 6 feet of distance. Third, wash your hands frequently, especially after you touch your mask. And finally, please stay home when you are sick. So while we keep doing what we can in public health side, we need help from everyone in our community to help slow the spread of COVID-19. And if you get a text message or call from Public Health, please respond to the survey. Responding to this survey helps us do our job in a more timely and efficient manner. Thank you.
Thank you very much, Marcy and Dr. Sonnenschein. At this point, we'll open it up to questions today, and please go ahead, Chad. Do we have anybody on the line?
We do. Rachel Langdon has a question. Rachel, your microphone is live.
Hi, can you just mentioned all of the parts of contact tracing. Just to clarify here, so Public Health is not calling contacts of positive cases at this time, and then what exactly, is this a staffing issue? It sounds like the true contact tracing of contacting all contacts is just not happening at this time.
All right, thank you for that question. Marcy Flanagan will address some of the intricacies of contact tracing and where we stand right now.
So I want to be clear. First of all, we are contacting 100% of cases that we get a test result for when we have their contact information. Contact tracing is the step that happens after case investigations. This is where all of our partners come in. That's U of A, ASU, the Crisis Response Network, AZ211, and what they are doing is we are enrolling all of contacts in the SARA alert system. That is a technology contact tracing tool that is widely used in the U.S. for contact tracing. So all of contacts are enrolled in the SARA alert system and monitor their symptoms on a daily basis. If they start to develop symptoms, Public Health is notified, and we will reach out to those individuals and walk through their symptoms and how to get them tested. So we are doing contact tracing.
La pregunta es si no se está llamando a todas las personas que están siendo los contactos cercanos con una persona que dio positivo a COVID-19. La realidad es que Salud Pública del Condado de Maricopa sí contacta el 100% de todos los casos que dan positivos y que tenemos información correcta para llamarles. Una vez que tengamos esa información, se hace una entrevista o cuestionario con la persona infectada. Ella nos da los contactos cercanos con los que estuvieron en contacto, dónde están, quiénes son, cómo localizarlos. Una vez que tenemos esa información, se comunicamos con cada una de esas personas para ver si desarrollaron síntomas. También trabajamos muy de cerca con organizaciones como Crisis Response Network, las universidades, ASU, el U of A y otras universidades locales, y también toda esa información se pone en un sistema de alerta llamado SARA. De ahí le damos seguimiento a cada uno de esos casos para saber si están desarrollando síntomas en el transcurso de varias semanas y darle seguimiento a cada uno de esos casos.
Pardon me, everyone, I forgot to introduce Joanna Molina today. She is here, as always, from Public Health to help with the Spanish translation during this question and answer period. So thank you, Joanna, for stepping in there. Chad, thank you again, Rachel, for the question, too. So do we have another person on the line with a question?
We do have several. Brom Resnick is next. Brom, your microphone is live.
Thank you. Hi, guys. Can Dr. Sunshine or Dr. Flanagan speak to the status of hospitals in Maricopa County? How many of them have stopped or limited elective surgeries? What other steps are they taking to deal with the huge surge in people in hospital beds and ICUs?
So, Bram, it's really interesting. We get this question a lot through the Joint Information Center about hospitalization rates and various twists or intricacies of that data. Hospitalization rates, as well as ICU use and everything else, is all being collected by ADHS, the Arizona Department of Health Services. This is under the executive order from Governor Doug Ducey. So ADHS is really your go-to place to go get information about hospitalization rates or ICU bed usage, that sort of thing. We are drawing upon some of that state information as well. Dr. Sonnenschein can expand on this a little bit more.
Hi, Bram. I can touch on your question a little bit. What we monitor in Maricopa County is actually the hospital capacity for the central region, which includes Maricopa County, Gila, and Pinal County. So that's why we tend to not divide those up. But what I can tell you is that we are meeting with the hospital executives, the chief medical officers, on a weekly basis, including discussing hospital capacity. And what I can tell you is that the hospitals, so remember during the stay-at-home order, they were not able to do any elective surgeries. So hospitals to varying degrees have started to do more and more elective surgeries, but not all of them ever got to the point where they were doing all of their elective surgeries. What I'm being told now is that the ones who started doing elective surgeries do continue to do them, some to a greater or lesser degree than others. But they still do have both hospital bed and ICU capacity existing, and we are just monitoring that very closely. But at this point, there still is some capacity.
La pregunta es que si cuál es el estatus de hospitales y si han dejado de hacer cirugías alternativas. La respuesta es que el índice de hospitales o de hospitalizaciones y camas son dependiendo de lo que reportan ellos al Departamento de Salud del Estado. Sin embargo, el Departamento de Salud Pública del Condado Maricopa trabaja muy de cerca con lo que viene siendo la capacidad hospitalaria para los condados de Gila, Pinal y Maricopa. Y semanalmente se tienen estas reuniones para hablar con los directivos y saber cuál es su capacidad y dónde está. Cuando ustedes recordarán que se hubo la orden de quédese en casa, muchas de estas cirugías alternativas se tuvieron que parar. Una vez que esa orden expiró de quedarse en casa, los hospitales pudieron seguir haciendo estas cirugías. Al momento, aquellos que han decidido hacerlas tienen la capacidad para hacerlas también. Al momento, también ellos tienen la capacidad de camas en cuidados intensivos. Así que los que han decidido seguir, lo siguen haciendo porque tienen la capacidad.
Thanks, Grant, for the question. Thank you, Dr. Sunshine, for expanding upon my knowledge and certainly clarifying the amount of communication that's going on between the hospital system and Maricopa County Department of Public Health. Chad, do we have some other people with questions? Thank you.
Pretty McCombs is next. Brady, microphone's live.
Hi. How has the dramatic surge in cases and the lifting of the stay-at-home orders impacted the work of the contact tracers in the county? Are the tracers able to keep up? Is it more difficult to pinpoint how people got infected and everyone they've been in contact with?
So thank you, Brady, for that question. So I'm not sure everyone was able to hear that on there, but yes, we're asking about the workload of contact tracing and how that's affected the systems that we're using and the questions we're being able to ask and how many people are able to reach. So Marcy Flanagan will address that.
So absolutely, as our numbers have increased, so has the demand on our systems. That's why we have added the additional partners with the universities. In addition, ADHS is also partnering with the National Guard. They are supporting Arizona's efforts for contact tracing. We never know where an individual where they became positive in the community. Since the stay-at-home orders have lifted and individuals are out in the community more, it would be nearly impossible for us to know exactly where they were exposed and became positive. But I'll let Dr. Sunshine expand on that a little bit.
So because there's so much community spread, we don't invest our efforts on trying to figure out exactly where someone became infected, but rather we focus more on what areas they exposed when they were infectious. And that way, we try to do it preemptively, and we focus on those high-risk settings where they work, where they go to school, and any communal settings that they were in where there was an opportunity for them to expose a lot of people. So that's really the focus of the investigation, is finding out who they exposed rather than trying to go backward and figure out where they got it, because we know they could have gotten it anywhere in the community, as Director Flanagan stated.
La pregunta es que si los que dan seguimiento a los casos positivos de COVID-19 pueden, con la demanda, como ha crecido ese número ahora en la comunidad, pueden seguir dando seguimiento a cada caso que resulta positivo. Y la respuesta es que sí, efectivamente, como los números están subiendo, también obviamente las investigaciones continúan y contactando a cada persona que ha resultado positivo. Por eso hemos trabajado muy de cerca y estamos trabajando en asociaciones como las universidades y otras instituciones. Ahora también el Estado se ha asociado con la Guardia Nacional para tratar de dar seguimiento a esos casos que están en la comunidad. Sin embargo, es difícil saber dónde cada persona se infectó. Por eso ahora Salud Pública de la Comunidad Maricopa lo que está haciendo es saber dónde la persona inició los síntomas de enfermedad, dónde fue que estuvo, con quién estuvo en la escuela, estuvo en el trabajo, qué personas estuvieron en contacto con ellos. De esa manera podemos contactar a las personas inmediatamente en lugar de definir en dónde ellos pudieron haberse infectado.
Thank you, Marcy. Thank you, Dr. Sunshine, for that answer. Thanks, Brady, for the good question. Chad, who else do we have on the line?
Erasmus Baxter has a question. Erasmus, your microphone is live.
Thanks. My question was, there was a story today in Arizona Republic about a guy who caught COVID after attending a crowded bar in Scottsdale where people were sharing drinks. He said that he was told by public health not to share the name of that bar. I was wondering if that's a policy and why that is the case.
Erasmus, thank you so much for the question. We've also talked to that gentleman, and so and for a story, because he also said a lot of very kind things about public health. So we're not really clear right now on what he may or may not have been told. From what we've learned so far, that's something we're asking the team. So I can't answer that directly today, Erasmus. Reggie, I want to fill in Spanish.
La pregunta es que salió una historia en medio de comunicación donde acerca del caso de una persona que dio positivo a COVID-19, que esta persona dice que se infectó en Scottsdale cuando estuvo en varios sitios tomando algunas bebidas y que se le dijo a él cuando alguien le llamó para darle seguimiento a su caso que no dijera los nombres de los sitios. Desafortunadamente no tenemos la información nosotros de quién pudo haber dicho eso o cuál es la historia detrás de todo esto. Sabemos que esta persona ha dado información que es muy pertinente a lo que se República hace, sin embargo no tenemos todos los detalles de lo que se le pudo haber dicho.
Erasmus, Dr. Sonnenschein will come up and talk a little bit about this as well.
Thank you so much for that question. I think it's important for folks to know that when we do talk to individuals who are infected and we do our contact investigation and find out all the places that they exposed, we often encourage them to go back to the people who were exposed, whether it be at a particular place or people that they were in close contact with, and we ask them to communicate with those people because they can often communicate with them much faster than we can actually get to them by phone, and ask them to share very specific information about what symptoms to watch for and what to do if they develop any symptoms. So it is our policy to actually enlist the community's help with letting people know that they were contacted, and it is not something that we routinely ask people not to name a particular place that they have been exposed or where they work, etc. We don't know what happened in that particular circumstance. We do everything we can to protect people's confidentiality, and there may have been a confusing message there. I want to be very clear that when we do contact the contacts of a case, so somebody that we know was exposed to a case when they were infectious, we never tell that contact who they were infected by. And so maybe there was some confusion with that, but we certainly don't have a policy of telling people not to name a particular place, because that is part of our community efforts.
Como parte de esa misma pregunta, la respuesta es que es importante saber que cuando a una persona se le contacta, se le hace las preguntas pertinentes. Esa persona nos dice dónde estuvo, con quién estuvo, quiénes pudieron estar expuestos. Salud Pública no tiene una política de decirle a la gente no digas dónde estuviste. Sí protegemos su confidencialidad, pero la persona sí puede decir lo que ella desee, siempre y cuando nosotros no lo digamos para proteger su identidad. Entonces esa persona tiene la posibilidad de contactar a las que estuvieron en cercanía con él o con ella, también a los sitios para decirle he estado infectado, estos son los síntomas, tengan precaución, porque ellos tienen acceso a esos lugares más rápido que lo que pudiera tener Salud Pública del Condado Maricopa. También cabe mencionar que no es una política, como dije anteriormente, que se le tenga que decir a la gente no digas esto. Sin embargo, la persona sí puede decidir hacerlo si así lo desea.
All right, thank you for the question. Chad, do we have somebody else waiting?
We do. Ann Ryman is next. Ann, your microphone is live.
Hi, thank you. The number of long-term care facilities with at least one COVID-19 case has steadily increased over time, and your latest statistics show that they jumped from 293 on Monday to 329 on Tuesday, which is a pretty dramatic increase. What are the reasons that you're seeing such a big increase there?
All right, thank you, Ann, for that question. Dr. Sonnenschein will talk a little bit more about long-term care facilities and the spread that we've seen in long-term care facilities, which of course is corresponded to the spread we've seen community-wide. So I'll have her address that question.
thanks for the question, Ann. So I can't speak to the jump on that particular day because I don't have those days' data in front of me. But I can tell you that we do have over 320 total, over 320 total skilled nursing facilities or long-term care facilities that have had at least one case that was infected. It's important to know that over 80 of those who did have a case were actually able to work with public health in infection control, get everyone in isolation, and completely stop the spread of COVID-19 in the population. So what we do is we work with them. We have all the residents in isolation precautions. We give them guidance on how to maintain infection control. And if they can go 28 days without having a single new case of COVID-19, they're able to go out of universal isolation precautions. And about a third have been able to get to that 2-month point. So we're always going to be focusing on long-term care facilities. It's impossible to keep COVID-19 completely out of the facilities because the staff are going in and out. So we're doing everything we can to keep visitors from going in, to keep non-medically necessary personnel from going in, but we are monitoring those ones that have new cases, and we do have a contractor now that can offer testing to facilities that are not able to stop transmission so that we can work with them to figure out what's happening.
La pregunta es, ¿qué está pasando en los casos de COVID-19 en instalaciones de cuidado de largo plazo y la propagación de COVID-19? En este caso podemos decir que no tenemos datos específicos a un día en particular. Sin embargo, sabemos que tenemos 320 instalaciones de cuidado de largo plazo que han presentado un caso positivo al menos de COVID-19. De esos 80 casos pudimos trabajar directamente con ellos, con salud pública, y ponerlos aislados y detener la propagación en esas instalaciones. También otro de los temas que hacemos con ellos es que si ellos logran pasar 28 días sin que se presenten más casos, pueden salir de ese aislamiento en el que se ha mantenido esa instalación de cuidado de largo plazo. Y un tercio de esos que hemos estado monitoreando ha podido salir de ese aislamiento. También invitamos a la gente, en este caso las instalaciones, a prevenir la propagación con visitantes que no puedan asistir a estos lugares, y también monitoreamos, y ahora tenemos contratistas que pueden ir a esas instalaciones y hacer más pruebas para aquellos sitios que no han podido controlar la propagación de COVID-19 en estos centros o instalaciones de cuidado de largo plazo.
Thank you so much for the question. Chad, do we have somebody else standing by?
Allison Steinbeck is next. Allison, can you
Yes.
look from the front?
Hi, thank you for doing this briefing. So we're seeing an increase in percent hospitalized and infection rate among the Hispanic population growing almost as fast as the Native American population. So I'm wondering, is there anything you can say about these demographic changes?
So demographic changes in the hospitalization rates of certain groups, and they're growing very quickly. So we're looking through some data right now because we want to make sure we familiarize ourselves. I would say Dr. Sonnenschein is looking through the data right now. Maybe this is a question we can come back to in a little bit. Yeah, why don't we get back to this question? Give us a second, okay? Since you're asking something very specific. And Rebecca, do you have something? All right. Dr. Sonnenschein can take that. We want to make sure we were ready to take that question.
Thanks, Allison. So the race ethnicity data is somewhat challenging, and I know that you're very familiar with it. In the beginning, we had less complete data than we have now. So part of the increase is that we were able to bring in data from other sources, particularly from hospital records and from the Health Information Exchange, to fill in those data. So at first it looked like there was not a disproportionate number of Hispanics who were infected and hospitalized with COVID-19, but as we were able to get more complete data, we found out that they are in fact at higher risk of severe disease, similar to Alaskan Natives and Native Americans. So those are definitely, and African Americans of course as well. So we are aware that they do have higher rates of hospitalization, and this is something that it's important for people to understand, that COVID-19 is no different than any other public health issue. Public health issues always disproportionately affect people of color and people with lower socioeconomic status and people with poverty. And that is very hard to tease out, but what we know is that there are certain races and ethnicities that are at higher risk, and people should be aware and take those precautions to protect themselves. And we're obviously doing everything we can to continue to communicate with everyone and make sure that masks are available to everyone, regardless of whether they can afford to buy them on their own.
La pregunta es que si el caso de los hispanos ha subido en las hospitalizaciones, y eso es algo que sí, ¿y a qué se debe? Bueno, al principio de lo que vino la pandemia no teníamos números específicos o que estuvieran diseñados para saber qué grupo étnico era el que se estaba viendo más afectado. Ahora que ya tenemos más información con respecto a las hospitalizaciones, que podemos obtener los récords de ellos y podemos darle seguimiento, podemos determinar quiénes son los que están en más alto riesgo. Al igual que los hispanos, otros grupos como afroamericanos y asiático-americanos también están en más alto riesgo. La razón puede ser por situaciones socioeconómicas o también por los niveles de vida en la que están ellos viviendo. Entonces ahora estamos trabajando porque no hay una discriminación en ningún grupo para que pueda aparecer COVID-19. Lo que estamos haciendo es estar colaborando para que toda la gente pueda utilizar una mascarilla facial o un cubrebocas. Y si no tiene manera de hacerlo, conseguir la forma para que también tengan un cubrebocas o una mascarilla.
All right, very good question. Thank you, Dr. Sunshine. We've received quite a variety of questions today, so we appreciate the questions, and I appreciate our experts here being able to step in and answer these. Chad, who else do we have on the line?
Shana Montanari. Shana, your microphone is live.
Hi. So my question is about restaurants and contact tracing. So if we hear that an employee contacted COVID-19, but through social media, but a business hasn't confirmed it, is there a way that we can confirm that kind of rumor? And what is the situation with dealing with potential exposures that happen at restaurants, like with restaurant employee, because it might be difficult to contact everybody that person came in contact with, especially if they're a server at work at a restaurant.
Sure, and I think as Marcy and Dr. Sunshine explained, it might even be impossible. And so there's a lot of forward looking whenever you do contact tracing, not as much looking back, which is what you're asking about. And you're really asking if we're going to say restaurant X had a case, therefore everybody that went there the last week should be aware. That is not something that public health reports out or environmental services. Marcy, would you like to expand on that a little bit?
So when we receive a positive case and we reach out to that individual, if they work in what we consider a high-risk setting, or they work in a place that we feel it's important that their employer knows, such as a restaurant, we would reach out to that restaurant and let them know of their employee that tested positive and see if there were any exposures in the workplace that way, in addition to asking the case. But we will not release publicly restaurants that have had employees who have tested positive.
La pregunta es que si los restaurantes, ¿cómo se le da seguimiento si una persona ha dado positivo, ya sea un empleado o alguien que estuvo en un restaurante dio positivo? Y si se confirmará si esa persona estuvo expuesto a algún sitio como restaurantes. Pero la realidad es que cuando una persona se da positivo, y está de alto riesgo, trabaja o estuvo en un sitio que pone más personas en alto riesgo, lo que se le hace es que se comunica directamente al sitio, al restaurante o cualquier otra instalación, se le deja saber el riesgo en el que estuvieron, las personas que pudieron haber estado en riesgo. Sin embargo, Salud Pública del Condado Maricopa no ha dado a conocer nombres específicos de lugares, precisamente por la confidencialidad de las personas infectadas o que estuvieron expuestas.
Thank you so much for the question. Chad, who's next?
Jacques Bigot is next. Jacques, your microphone is live.
Hi there. A lot of people in Maricopa County weren't wearing masks a few weeks ago, and more people are wearing them now. But there's still a fair number of people just not wearing them. Does the county have any regrets about not requiring masks sooner? It seems it might have if people in government might have been pushing this sooner, maybe the culture wouldn't have, made so many people think that they were all right walking without a mask. So I'm wondering, do you guys have any regrets about not requiring masks sooner?
Any regrets? Well, that's a tough question, Jacques. As you know, we've instituted a regulation countywide as of last Friday. The Board of Supervisors stepped in with that. Considering the advice of public health, I'd invite Marcy to come up and say a few more words about that.
Thank you for that question. Prior to last week, the regulations for masks or any local ordinances or rules or regulations were not allowed to be made. The governor had his executive order in place, his emergency declaration that only allowed state level regulations to be put in place. So once that was lifted, he did that looking at the numbers and seeing how, especially in certain parts of Arizona, the numbers were increasing significantly. So as soon as that authority was given down to the counties and cities and towns, we made that recommendation to Maricopa County Board of Supervisors to act on it, and we did.
La pregunta es que si la gente no está usando las mascarillas, hay algún tipo de arrepentimiento por parte de lo que viene siendo el Departamento de Salud Pública del Condado Maricopa de no haber requerido con mucha anticipación el uso de estas mascarillas. Bueno, la respuesta es que antes de la semana pasada todavía teníamos, la autoridad principal tenía la oficina del gobernador. Una vez que el gobernador dio luz verde y le dio la autoridad a las ciudades, a los pueblos y también a los condados de hacer sus propias regulaciones, es cuando Salud Pública del Condado Maricopa vino y dio esa recomendación a la Junta de Supervisores e inmediatamente se puso eso como un requisito.
Thank you, Jacques, for the question. Chad, who's next?
Hi, Phil is next, and time permitting, I have a few follow-ups after him. Mike, your microphone is live.
Hey guys, can you just talk about, back to contact tracing, how many people, can you give us a sense, how many people who are COVID positive are having their contacts traced on a daily basis? And given the surge in cases, are there enough resources, and is it even feasible at this point to contact trace the level to make a significant difference in slowing the spread?
Okay, so there were several questions in there, many of which we've already covered today. As far as staffing level, I can tell you that everybody who has tested positive that we have contact information for, that they have been contacted either by an investigator or a contact tracer. Marcy Flanagan will expand on that.
So the question is difficult in answering how many contacts of cases we're able to get a hold of in a day, primarily because each case is going to have a different number of contacts. In addition, we're using so many different resources. As I stated, every positive case within 12 to 24 hours is going to get a text message and a phone call from public health asking them to fill out a survey that's going to collect more information and also the name of their contacts. The more individuals that do that, the quicker their contacts are going to start getting notification to enroll in the SARA alert system. And the past few days, we've seen over 1,000 people a day enrolling in that service for us. In addition, not only to the partners that we have that I spoke of, the university partners, and Arizona 211, ADHS also is working on cases with us and has the National Guard working on cases in Maricopa County. So all the cases are being contacted, their contacts are we're asking for their contacts information and enrolling them in the SARA alert system.
La pregunta es cuántas personas se le da seguimiento por día para reducir la propagación de COVID-19 una vez que una persona ha sido dado positivo. La respuesta es que es un poco difícil dar un número exacto porque cada persona que resulta positivo tiene diferentes números de contactos cercanos con los que pudieron haber estado expuestos. Entonces depende del número de contactos de esa persona y también qué tan rápido nos da la información para poder contactar a estas personas. Como mencionamos anteriormente, Salud Pública del Condado Maricopa, entre las 12 y 24 horas que se nos ha dado un caso positivo, la persona recibirá un mensaje de texto y también incluyendo que nos dé los contactos cercanos para poder empezar la investigación o el contacto con ellos y decirles que pudieron haber estado expuestos y qué deben de hacer para evitar la propagación del COVID-19. Cabe mencionar también que son más o menos 1,000 por día los casos que se le da seguimiento desde la semana pasada. También trabajamos con los socios que mencionamos, como las universidades, y en este caso el Estado también ha hecho esta asociación con la Guardia Nacional para darle seguimiento a cada uno de esos casos positivos y los posibles contactos que pudieron estar expuestos.
Thank you very much, Marcy. Thanks, Mike, for the good question. I know we have some follow-ups, Chad, so we probably have enough time, 2, maybe 3 more. So let's try to get to some of those.
Let's start with Rachel. Rachel, your microphone is live.
Hey, so I know that, I can't remember who said it, but someone said that you're not tracing to a specific location or activity. But are you seeing commonalities in activities or locations? I'm thinking like churches, restaurants, protests, things like that, that cases have been going to. I know we're all trying to mitigate risk here and understand where are risky places, so any info you can provide there I think would be crucial for people's understanding of, going out in the world.
Okay, thank you, Rachel, for that. And I know, we've been asked various versions of this question a number of times. So Dr. Sonnenschein will take a stab at answering this. Maybe she's addressed some of these items a little bit, but we'll talk a little bit more about that.
So I think it's an important question. What we do when we hear of a particular location that somebody was at where they were either potentially exposed or where they exposed others. And what we do is if we hear the name of a particular place or a facility that hasn't been named by others as of yet, we do record it down and we have a list that is ongoing. And then if it's named by enough individuals, we have a threshold where we consider it an outbreak. And then we enter it into an outbreak module. So all of the long-term care facility cases that you have heard about even today, those are all entered into the outbreak modules. We certainly have had some outbreaks in some child care facilities, which is inevitable because children are not known for their hygiene practices. And they're obviously necessary to keep them open, but it's typically those types of settings where people are living communally, or else infection control is more challenging when people either aren't able to have infection control, when people don't have the resources. The other setting that we monitor very closely, we've talked about this, are individuals who are experiencing homelessness. Sometimes that's more challenging to prevent spread, and also in the jails. So we are constantly monitoring all of those settings, but if a place is named multiple times, it is entered into our system as an outbreak, and we work with that facility to make sure that people are notified specifically of their exposure.
La pregunta es que ya se nos había mencionado que no se da a conocer una localidad específica de los casos de COVID-19, tales como iglesias o marchas o restaurantes, para decir dónde han sucedido estos casos de COVID-19. Sin embargo, lo que sí sabemos que Salud Pública trabajamos muy de cerca para saber si cada caso que da positivo y se le hace una investigación o se hace una entrevista, nos dicen en dónde estuvieron expuestos. Nosotros tenemos una lista de lugares o de sitios, y si eso se repite constantemente como un lugar común donde pudieron haber estado expuestos, entonces Salud Pública directamente contacta a esos lugares, les dice la situación y cuántas personas pudieron haber estado expuestas o están infectadas. Por ejemplo, los centros de cuidado infantil, o también donde vive la gente en grupo, suelen ser algunos ambientes donde hay más brotes de enfermedades. Y también vamos a mencionar que otros sitios pueden ser lugares de personas desamparadas o personas sin hogar, cárceles, y cada uno de esos sitios se trabaja diariamente con ellos para identificar casos y evitar la propagación del COVID-19.
Thank you, Dr. Sunshine. Thanks, Joanna. Chad, we have time for one more question, maybe two. So who do we have next?
We have Ron Resnick is next. Ron, you're on first line.
Hey guys, a follow-up on the contact tracing question earlier. Can you tell us what percentage of cases get a full contact tracing within the 24 hours recommended by the CDC? Also, last week Governor Ducey issued an executive order that appears to give DHS supervision or some kind of control over all contact tracing in Arizona. Can you help clarify what the relationship is there? Thank you.
Marcy Flanagan can address that, Brian.
Hi, Brian. Thank you for the question. It's difficult for me to be able to answer the first part of your question, wanting to know the percentage. First, that's something we just don't track at Public Health. But secondly, a lot of that depends on, as I mentioned earlier, 15% of our cases come in with no contact information at all. We're able to obtain some contact information for a portion of those, but there's 5 to 7% we're never able to obtain contact information from. So that's going to play into how many individuals we're able to really find out their contacts. So I'm not going to be able to answer that part of your question. The second part about the role of ADHS, the governor did identify ADHS as taking on a lead role in the case investigations contact tracing statewide. We met with all the local health officers in Arizona and ADHS to walk through what that statewide plan would look like. The great thing for Maricopa County is that the plan that the state is implementing really complements and just enhances the work that we were already doing. So the main goal of the statewide plan is to be able to prioritize all of the cases throughout Arizona based on priority levels. And so those highest priority levels with the highest level of acuity are going to be investigated by local public health. Those cases tend to be a little more complicated, a little more time consuming. Those will stay with Maricopa County Department of Public Health. ADHS will then focus their efforts on that next set of 20 to 44-year-olds who seem to have the highest percentage of cases in our community right now. And they will work with their partners and the universities to contact those individuals. So the statewide plan is really making sure that all local public health departments were handling cases and investigations the same way, in a uniform way, statewide.
Es una pregunta acerca de darle seguimiento a los casos de COVID-19 y qué porcentaje se le da seguimiento en 24 horas, como es recomendado por el Centro de Control y Prevención de Enfermedades, o CDC. Bueno, el porcentaje exacto del condado de Maricopa no se sabe porque todo varía. Sabemos que el 15%, como lo dijimos anteriormente, de estos casos que llegan no nos dan información completa o correcta. El 5 a 7% tampoco ponen los contactos que les pudieron haber estado expuestos a ellos con COVID-19. Entonces eso hace un poquito más difícil la tarea de poder contactar a todas las personas dentro de ese periodo de 24 horas. Sin embargo, también el gobernador ha dado autoridad al Departamento de Salud del Estado para dar seguimiento a nivel estatal y crear un plan donde tanto los condados del Estado trabajen juntos, unidos, en dar seguimiento a casos. En este caso, el Salud Pública del Condado Maricopa y otros condados darán seguimiento a casos más complejos, y lo que viene siendo el Departamento de Salud del Estado dará seguimiento a los casos entre las personas de 20 a 44 años, y ellos trabajarán con universidades y también con otros socios para dar seguimiento, pero este es un plan uniforme donde cada quien tiene su rol y trabajan juntos.
Thank you so much for the answers. Thank you, everybody, for the questions. I'm sorry we've run out of time on the webinar. We are coming up right on the 2 o'clock hour here. So for any reporters that didn't get a question answered, or you have follow-up questions that you feel weren't covered in this hour-long press conference, please email the Joint Information Center. We'll do our best to get you an answer in a timely fashion. Let us know your deadline if you're on a really tight deadline, and we'll get back to you as quickly as possible. With that, thank you so much. Thank you so much to the public, everyone joining us on Facebook or YouTube. Thank you so much to members of the media coming on and asking some really good and enlightening questions today. We certainly shared a lot of information, and we appreciate your time. So we will put out a notification the next time we have an availability. Thanks again. Good.
Can you hand me my phone?
Thing shut down twice, just completely. I mean,
The YouTube feed?
no, the computer.
Which is, yeah.
The computer.
Center will do our best to get you an answer in a timely fashion.
I am.
That's right.